Hello, Professor and colleagues. My name is Nancy Mata. I am 46 years old and I'm married with 3 children. I have worked in New York since 2007. In 1994, I decided to pursue a career in the healthcare field, and without a doubt, I began my studies as a medical student, graduating in 2002. Since then, the consultations and extended services in clinics and hospitals have been new experiences where I always learned something new. I still remember that one day I was on a call in the emergency room when a pregnant patient suddenly arrived to have her baby. She had gone to various hospitals where she was rejected because the baby was upside down. So faced with the situation, I told the nurse to get ready to help me. At that moment, I asked God for divine intervention to solve this difficult birth, and thank God the baby was born in perfect condition. I am a registered nurse, and I have 2 years and 3 months working as a primary physician's assistant. I perform a medical history, order laboratory tests, refer to specialists, and educate patients diagnosed for the first time with chronic conditions such as diabetes, hypertension, and hypercholesterolemia. I remember that on one occasion, I had to inform a patient about the results of a urine culture. These results demonstrated bacterial infection with more than 150,000 E. coli. It was not the first time that she would receive treatment for this reason. When I analyzed that this patient needed education on how to clean herself properly when she used the bathroom, the problem disappeared after receiving this type of education plus antibiotic treatment. Although it is a simple experience, I learned the importance of patient education to treat it. The advanced nursing area that I chose is that of adults. That is, I hope to become an adult family nurse practitioner upon completion of this master's degree, and as such, I will perform the same role as an adult primary care physician, which is to diagnose, treat, prescribe medications, refer to various specialists, advise and educate to my patients, but above all, prevent disease, which is the most important thing. I chose this area because I work with adults in primary care, and I felt satisfied talking with my patients and knowing what they think and how they express it. Adults have the capability of expressing their feelings much more clearly than any other ages, and this allows me to act with greater confidence in how to treat their health conditions. One of my biggest challenges in practice, which is very common, is when I have a patient who does not speak English, since it is always essential to make sure that they understand when you explain a diagnosis, procedure, or treatment. In my case, it is not the same to communicate through a second person, since there is a probability that there are translation errors. It is a great challenge for me because as a healthcare provider, I often feel fear that my patients have not correctly understood the information or recommendations given. My goal is to gain the knowledge necessary to become a nurse with advanced training to provide the healthcare typically provided by a primary care physician.